Crohn's disease is a chronic enteritis that can affect the gastrointestinal tract from mouth to anus. The exact etiology of Crohn's is still unknown, but is associated with genetic and environmental factors. Genetically, the CARD15, formerly known as the NOD2 gene, is associated with Crohn's due to mutations causing amino acid substitution in an area thought to be responsible for bacteria recognition. CARD15 also activates nuclear factor kappa B as part of the immune response, which stimulates the overproduction of tumor necrosis factor associated with inflammation in Crohn's. Clinically, Crohn's will present with abdominal pain, cramps, prolonged diarrhea, weight loss, low-grade fevers, fatigue, and malaise. Crohn's is diagnosed by clinical biopsy, CT scans, MRI scans, and the hallmark cobblestone appearance of intestines seen via endoscopic procedures. You can see the cobblestoning here on the intestines. Current treatment goals of Crohn's is to achieve remission. There is no cure. Humira is a TNF alpha targeting drug and functions to disrupt interactions between TNF alpha and its receptors by binding to the TNF alpha receptor binding site. Here you can observe Humira as the purple and blue chains. It has a heavy chain, which is the purple, and a light chain, which is the blue, and it binds to the TNF alpha, which is the green. Here in the lower left-hand corner, you can observe the Humira with the red ends binding to TNF with the blue end.
Hi, my name is Kenzie and I'm 22 years old, and I was diagnosed with Crohn's at the age of 18. I've always remembered having symptoms of Crohn's from a much earlier age. My primary care doctor ran lots of different tests from a colonoscopy at age 13 to CT scans. To my frustration, tests came back without any findings. It was beyond upsetting to feel like I wasn't being taken seriously. I wasn't officially diagnosed with Crohn's until I moved away from my small hometown to a suburb of Minneapolis. I had just gotten engaged and I didn't know anyone in my new city, nor did I have any sort of doctor. During this time, my pain level was outrageous and I could not keep any food down. After numerous ER visits, the cycle was the same: CT and sent home with pain meds. That's when things started to go from bad to worse. I was taken by ambulance. Nurses were coming into my room, trying to hide their panic as they watched my heart rate climb. It didn't seem like much time until the doctor came in and saying we needed to go straight to the OR. I was later told my intestines had perforated and that my entire stomach cavity was filled with waste. I was told that 12 inches of my small intestine were removed and that I had finally been diagnosed with Crohn's. I would like to say Crohn's has impacted my relationship, but even I have to admit it takes a lot of patience and empathy to love someone with a chronic illness. My everyday life is focused on managing my disease. It's almost like a full-time job. Treatments, doctor's visits, medications, it's just a lifelong journey I have to deal with. But for right now, I'm happy that my treatment plan has finally put my disease in remission.